In tonight's Health Edge, we're talking about two types of medical procedures that women have when they're younger that could give them a better chance of getting pregnant.
Let's bring in our chief health editor, Dr. Partha Nandi. And Dr. Nandi, curiosity abounds. What are those?
Yeah, exactly. We're talking a little tongue in cheek, but if you've had your tonsils or appendix removed, if you have had that and you're a woman, you probably weren't told that the surgery may actually increase your chances of having a baby. That's right, increase. In fact, you maybe have been told the opposite until now.
So what is the correlation?
Yeah, it's an interesting question. Now, this is an association, so it's a 15-year study found that women who had their tonsils or appendix removed when they were younger are more likely to get pregnant and to do so earlier in life. Now, we don't understand the exact reasons behind the link yet, but the research that the university have done, they examined the medical records for more than 530,000 women, so a lot of women across the UK, and found pregnancy rates to be higher amongst women who had had their tonsils or appendix removed. Pregnancies were even higher amongst people missing both. So pregnancy rates for women lacking both their appendix and their tonsils were 59% compared to the rest of the population, which was 44%, so a significant increase.
Was this understood before now?
Yeah, so we were told the opposite. So these findings actually go against previous surgeries or theories in medicine that these surgeries, especially appendectomies, decrease the chance of fertility because you thought that scar tissue were formed around the woman's fallopian tubes where their eggs travel. The study has challenged that idea that appendectomies actually decreased fertility. Now we feel that young women should not have any fear or anxiety about an appendectomy or having their tonsils taken out and then reducing their fertility.
So, Doc, why do you think this is?
So
Why do you think there's a link?
I think there's a couple of theories. It's a really good question. Number one is, could it be biological, behavioral? So we need to understand a little bit more. Researchers believe that if it's biological, then what happens is that the inflammation that occurs within the body from a surgery, like when you have an inflamed appendix or tonsils, put the strain on the burden of the body, weakening it, decreasing the chances of conception. Now, here's the other theory. Some researchers suggest that the increased promiscuity among some women and increased contact and intimacy through kissing or sex may directly increase chance of tonsillitis and chance of abdominal infection. This would not cause appendicitis, but lead to more abdominal infections and pain, and could lead to more hospital referrals, and then your appendix will be taken out because you're in the hospital.
Okay.
That is fascinating.
Yeah, indeed it is.
Yeah.
Now, short of having your tonsils or appendix
Would not
out,
recommend that
which of course
unless
you
you
would
need
not
it.
recommend, what would you do?
By prescription. So clearly we want to try to avoid any risk which would increase the need for removal of your appendix or tonsils, but we can decrease infections by proper hand washing and hygiene. Number two, if you're trying to get pregnant, then focus on what you can prepare your body for optimal fertility. Eat a healthy plant-based diet we talk about all the time. Number three, please take prenatal vitamins while you're trying to conceive. I'm a true believer in daily vitamins, and that helps to supplement your diet. And lastly, exercise. Moderate exercise, 3 to 5 times a week, 30 minutes a day, with brisk walking, swimming, and yoga are perfect. And those are really the ways to go if you want to increase your fertility chances.
Wow, Doc, thank you so much.
I appreciate it.
And if you have a question or a health concern for the good doctor, you can email him at drnandi@WXYZ.com. Send it to us, Facebook or Twitter. He's on Snapchat right now.
Exactly.
In other health news, health